Good afternoon, everyone, and thank you for tuning into our media update on this Friday. As you may know, after reviewing the COVID-19 data and trends over the past week, today, following discussions with our Medical Officer of Health, and Dr. Richardson, Premier Ford has made the decision to move Hamilton into the red control category with the provincial COVID-19 framework. This change comes into effect on Monday at 12 a.m., so that'd be Sunday night at midnight. And earlier today, the provincial government lowered the threshold for the categories on each level of provincial COVID-19 framework. The updates are meant to help limit the spread of COVID-19 while keeping schools open, maintaining health system capacity, protecting the province's most vulnerable, and avoiding broader lockdowns. So without further ado, I'm going to turn it over to Dr. Richardson to explain what this means and what we can expect to unfold over the next coming weeks. Dr. Richardson.
Thank you very much, Mr. Mayor. And I want to just go through some of the numbers for us, understand what the changes are that have been made in the framework, and some of the changes in restrictions that are happening here in Hamilton. So as we've been talking about, it's been very concerning over the last couple of weeks. Our case numbers and outbreaks have grown to worrisome levels. As of today, we are at 2,341 cases here in Hamilton with 46 new cases from yesterday. Unfortunately, we do have an additional death as well. We're at 60 deaths now with one new death, a woman in her late 80s from Chartwell, Willow Grove, who passed on November 11th. We are currently reporting 19 outbreaks with 2 new outbreaks reported today, one at Meridian Credit Union and the other at Jonathan's Perron floor coverings. As the mayor said, reducing spread of the virus, keeping our schools open, and protecting our health system, as well as those who are most vulnerable, are our priorities right now. Based on the continuing concern about spread, not only here in Hamilton, but across the province, and the new modeling that was available from the science table yesterday, the Chief Medical Officer of Health updated the framework for reopening in Ontario with new thresholds. The changes lower the threshold for each of the 5 categories, yellow, red, orange, all of them. And after carefully reviewing the data and trends over the last week, following discussions with myself and the Chief Medical Officer of Health, Premier Doug Ford has made the decision to move Hamilton into the control or red category within the provincial COVID-19 framework. This will come into effect on Monday, November 16th at 12:01 a.m. Just to let you know in terms of the numbers, what it is that fits with that new the adjustment of the indicators in the framework. Our rolling 7-day average increase in new cases sits at 52, and the threshold for the red framework is 40 cases per 100,000. The percent positivity sits at a threshold of 2.5% for the red category, and ours sits at 3.0. The reproduction number, the threshold there for the RE is 1.2, greater than 1.2, and ours sits at 1.23. And as well, repeated large outbreaks in multiple settings is another factor that is considered and is one that is happening, unfortunately, here, as well as the level of community transmission. We're lucky that for by far the majority of our cases, over 70%, we're still able to track, and most are related to outbreaks as well as direct contact with cases, but we still have a worrisome level of community transmission. So going forward, I want to start with what is being required for everybody across the province, regardless of what level we're in. And it's really important measures that the public are being asked to take. And these are consistent with what we've been talking about over the last several days about what is so important for each individual person to do in order to control the spread of COVID-19. So these are to restrict your close contacts to your household members only and your essential supports. The concept of the social circle has been set aside right now. Those that live alone may join with another household for support. All in-person activities should be limited outside of the home to essential services only, activities only. So these include work, school, fitness and exercise, access to healthcare, and the purchase of food, drink, gasoline, and automobile maintenance. Restriction of all social gatherings to only immediate household members. So if there were any celebrations, it would only be amongst those household members. Wearing a mask or face covering when around others from another household. So if somebody needs to come in to do some service in your house because you're having a challenge with your furnace, or because somebody is coming to tutor your children for their schoolwork, then they need to be wearing a mask. washing your hands often, and of course, as we've talked about several times now, staying home if you are sick with symptoms of COVID-19. Unfortunately, we do continue to see that people are going out to work or going out to other households when they are feeling ill. So if you feel ill with any of those symptoms, please stay home and get tested for COVID-19. I want to give you a sense of what these further restrictions mean for organizations in Hamilton. The full details our staff are updating are going to be on our website over the weekend, but here's some of the changes that you can expect to happen as of 12:01 a.m. on Monday. These include that the gathering limit for all organized public events and social gatherings will be 10 people indoors and 25 people outdoors. So those restrictions will be in place. Further restrictions on restaurants and bars, as well as meeting and event spaces, including a maximum of 10 people indoors, no dancing or singing. Further restrictions for recreational programs and team sports, including training only and no games. Expanding the screening of patrons in personal service settings and malls, as well as in restaurants, banquet halls, and those spaces. The closure of cinemas, except for drive-ins, and the closure of performing arts facilities. So that's a sampling of what is at the red level within the provincial framework. But as I said, we will have very detailed information up on our website over the course of the weekend. In terms of how long these measures will be in place, the Premier put these in place for a period of 2 incubation periods or 28 days, unless the indicators worsen, at which point we may move to the higher level at an earlier time. And I know that the Chief Medical Officer of Health and others are looking at what it might mean to move further into a lockdown, and that is being considered. Adjustments to the category will be decided by the provincial government using the indicators based on the previous 2 weeks of information or sooner if there is worsening. So moving into this category is important for us. It's necessary for us here to protect the health and wellness of Hamilton. Further details, as I said, will be found on our website. And as well, we'll be having a session with the Chamber of Commerce on Tuesday to help businesses understand what this means for them and how they can operate safely. Over to you, Paul.
Thanks very much, Dr. Richardson. And just wanted to highlight that obviously these changes will impact some city services. The vast majority, though, the basics of service of the city of Hamilton will continue to operate. So not to worry about changes to the day-to-day services of waste collection. And as we move into December, because as you heard, this is a 28-day period, snow removal, those types of things would all continue. Our water services have gone throughout. Emergency services are there at your disposal. This is really for some of the other programs that have opened, I would say, since the summer on. The biggest impact will be for recreation, and our staff are going to work over the weekend to fully update all of our recreation programs and provide that information through our website over the weekend. I know that for some, perhaps even on first thing on Monday morning, you're planning on coming to our recreation facilities. I would encourage the public to absolutely check our website, make sure that there haven't been modifications, changes, or cancellations to your programs based on these new restrictions, which do come into effect obviously at midnight and then would be in effect for Monday. The biggest piece of change is going to be working with our hockey user groups in particular, and other team sport user groups of our recreation facilities, because there is a major, obviously, reduction in the activity that has been enjoyed by those groups up until this point. So we will do some proactive reaching out, but for those that have things booked or are expecting to be in our recreation programs on Monday, please come to our website, hamilton.ca. /coronavirus, and you can find all the information there. Our staff will also be over the weekend reviewing any event applications that have been approved at the previous levels, and we'll be obviously rescinding those approvals if any events that have been approved are beyond that limit. And obviously we will not be accepting applications that are outside of the limits that are now placed on events, either indoors or outdoors. From an enforcement perspective, This will not change the fact that we will be enforcing. It obviously changes what the enforcement regime looks like. And again, nothing changes there in terms of our team is out there 7 days a week, in the evenings, on weekends, during the day. They will be continuing to do both proactive and reactive enforcement. And starting Monday, we'll be enforcing to the new regulations and the new restrictions. So I encourage all business owners or operators of programs, please take the time over the weekend to familiarize yourself with what you should be doing as of first thing on Monday, so that again, if our bylaw officers attend your premise, that you're in compliance with where things are at now. So obviously through the weekend, things will change. We are trying not to put out information now that might change when we go through and understand all of these, all of the implications. So unfortunately, folks will have to wait through the weekend as we just get clarity around this and start things on Monday morning. But I do want to say, very clearly that those sort of core services on a day-to-day basis at the City of Hamilton are unaffected by this, as they have been throughout the pandemic. And those critical services and essential services and emergency services here at the city remain at your disposal on a day-by-day basis, an hour-by-hour basis. So thanks very much, and I'll send things back to the Mayor.
Thank you, Doctor. Thank you, Paul, for that, I guess, unfortunate news. The good news is this is not a lockdown. The bad news is these are more restrictions that, as a result of increasing cases, I think are necessary. We cannot have this spread out of control, and the whole mission here is to control the spread and not overtop our healthcare system and protect our citizens from this virus, many of whom might have the virus and not know it and spread it to others. And so the masking, all the things that our public health are asking us to do, you need to double down. Stay within your own home as much as possible. If we think back to the kind of reaction we had back in March, April, May, when you were asked to limit your exposure to others and stay within your own household. If you went shopping, you only went alone, not with two people, but with one, to minimize the contact. All the things that we were asking you to do then, you can do now, but many of the facilities that would have been locked down then, many of them would be open, like the trails and the parks and the park facilities and the stairs, none of which have been shut down at this point. And so accessibility is much greater than we had back then, and we are much better prepared. But the reality is the numbers are going south and or north, depending on your perspective, not in the right direction. And, the prognosis on potential of having 6,000 to 7,000 cases certainly was a frightening prospect. And I think what we're trying to avoid is anything anywhere close to that. And so thank you, everyone, for doing what you're doing. Let's think about doubling up our efforts. Let's talk to our friends and neighbors, our parents, our kids, to ensure that they're all doing the right thing. And if we do, we can get again through this crunch together, flatten the curve, and hopefully get something nailed down a little more concretely before Christmas. With that, I'm going to turn it over to Jasmine for questions from the media. Jasmine?
Great, thank you, Mr. Mayor. We'll start with one question and one follow-up for each of you. First is Taz Boga from CHCH. Taz, you can go ahead.
Hi, Jasmine. I'm not sure anyone can answer this, and this goes out to either Dr. Elizabeth or Mr. Mayor. Can you give us some concrete examples of how, what new restrictions we can expect in terms of numbers and capacity at things like restaurants, businesses, religious services? What changes, because we're already operating at a reduced capacity, so what changes could we see come Monday?
Going to leave it to you, Doctor.
Sure, absolutely. Thanks, Taz. So number of changes come into effect. So a lot of it involves screening being implemented in restaurants, any facilities that do remain open so that patrons are being screened. There are limits now to establishments like restaurants and bars where only 10 people are allowed for indoor dining. Takeout, of course, is unaffected. There are closure of performing arts facilities except for the purpose of recordings or practices that may still be allowed, but certainly not performances with spectators. The changes at the recreational facilities, as I mentioned, with no further team sports in terms of games, but there is still training allowed. Spectators, of course, aren't allowed for that. So there's a number of changes that come. They're outlined in the provincial framework, and we're going to get all those details up on the website.
Okay, one quick question again, if you don't mind following up. You said that there has been one new death today and 2 new outbreaks. Could you repeat where, which residence that death was and where the 2 new outbreaks are?
Absolutely, for sure. So the new death, I'm just going to make sure I do give you the right name. The new death, I believe, was at Chartwell Willow Grove. And the 2 new outbreaks are both businesses. They're both workplace-based outbreaks. And they are at the Meridian Credit Union on here in Hamilton and at Jonathan Perron's floor coverings.
Sorry, Jonathan?
Perron floor coverings. So you can get there's further details on the website if you want to get the spelling and that sort of thing.
Okay, if I'm able to, if you can entertain one more question. With these rising case numbers, what is your message to the people of Hamilton that maybe have, experienced COVID fatigue and are just overwhelmed and maybe maxed out?
Absolutely. We understand that people, this has been a long period of time with the pandemic. People are feeling overwhelmed. They want to get back. They want to connect with people. But at the same time, there's very serious consequences that come along with COVID-19. They come along in terms of our individual health, the health of our loved ones, the health of people who are vulnerable in our society, and protecting our healthcare system to serve not only people who have COVID-19, but people who have heart disease, cancer, all of those things. And overwhelming that system or having to go into further lockdown to control it would have very significant effects for the people in our community. So we had a great session last night about mental health on our town hall, and we had great advice about how important it is to think about all aspects of our life at this time, and we all need to be innovative and in terms of figuring out how we can connect and be resilient and look at where the opportunities are so we can be those things right now, as opposed to, being upset by the restrictions that are put in place. So we need to follow those restrictions. It's critically important that we do that we do all these things about staying home, being only with your household members, only going out when absolutely necessary, but at the same time, find ways to do things virtually to maintain your mental health, to support your kids, and reach out for help when you need it, whether it's for healthcare, for your physical health, or for your mental health.
Great, thank you, Dr. Richardson. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. I guess this is for Dr. Richardson or Paul Johnson. Will the City of Hamilton be adding its own restrictions on top of what the province has already put in place?
I can start that off, Paul, and then add as you see fit. Right now, we don't have specific restrictions that go beyond this. We do have some clear interpretation of the guidance that is out there on the framework. And so there are some details that we are putting in place on the website that will help you to understand what it means. But these restrictions are pretty strict. And so there's not a lot of room to go beyond these except for into full lockdown. That said, when it comes to individual facilities, you've heard about enforcement that our MLE colleagues will be doing as well. We will continue to look on a premise by premise basis if there's any concerns that require further interventions from public health, whether they're orders or that sort of thing. And if we do see something where there is a gap or there's a challenge that needs to be addressed, we will speak to it and we'll move forward to address it.
Okay, thanks very much. And the second question I had was we heard that there was an anti-mask gathering in front of City Hall last weekend. Now, there was a fine issued against the organizer. Just wondering if I can get their reaction to that incident taking place kind of so prominently in the midst of all these cases that we're seeing.
We could all take a shot at that one, I think. But let me try. Look, I mean, people have varying opinions on this. We're working with the mass of the population to ensure that they do the right thing. There has been opposition. There continues to be some people that'll never accept this as a critical disease, and you hear all kinds of conspiracy theories about whether or not we're controlling people's lives and taking away rights and God knows everything else. None of that is happening. The reality is that it's irresponsible for people not to be wearing masks at this point, especially at this point, given that we're at a critical phase where the potential virus running out of control is near and clear and present danger. And so, what I say to those folks that are, supporting the anti-masking efforts is don't be silly. Think about your parents or your loved ones and anyone else. And, it's funny that, there's a lot of opposition until somebody gets COVID. And suddenly there's a complete change of tone and complete change of their idea about what this all means. And some people think that COVID is just kind of a come and go event. Some people die, some people get very sick, some people get lingering efforts that lasts a long time and could be with them for their entire lives. And every sector of our population is potentially at risk. Having said that, the doctor just pointed out that one of the key issues now is looking at our healthcare system and ensuring that we don't cause it enormous amount of stress whereby they have to make choices between who gets care and who doesn't get care in the full spectrum of the kind of hospital care that's out there. And so the anti-maskers need to stop being silly. They're going to protest. I can't help that. We're going to work past them and continue to do what's important for our community and the safety of our citizens, which is follow the science, follow the public health recommendations, and we will get through this together. Down the road, there will be a vaccine. It's not just around the corner, but it's hopeful that it's there. And I would say within the year, we're going to be in a better place. But for the time being, we need to tough this out.
Great, thank you, Mr. Mayor. Next question will be to Dan Takema from CBC Hamilton. Dan, you can go ahead.
Hey there, this is for Dr. Richardson. I'm wondering, obviously we have these outbreaks with high case counts in congregate settings, but I'm wondering if you have a sense of what kind of activity has been leading to the rise in cases. We've heard in places like Niagara about social interaction, for example. So just curious about if you have a sense of what kind of activity is leading to the rise in cases here.
Yeah, absolutely, Dan. And it's clear there still is regional variation in terms of what happens, around COVID-19. And so what we see in Peel, for example, what we see in Toronto, each region is having their own specific experience, if you will, with COVID-19 and what the key issues are in those areas. So for us here in Hamilton, and I think this is something that is consistent across the province, socializing is one of the biggest drivers for us. And so it is people who are continuing to go out, who are not wearing their masks when they're with others from outside their household, who are getting together in larger numbers. And it is people who are going out when they are still sick or when they are sick rather than staying home, staying isolated and getting tested. Unfortunately, we see that to some extent too in workplaces where people aren't necessarily following the guidance around wearing masks and distancing on lunch breaks or when carpooling to and from work. So those have been the major drivers that we hear when we're talking to cases, and that's why we've been emphasizing so much the socialization piece. You've seen that in the past, we did have the issues that led us to recommend further restrictions on gyms, and those restrictions almost completely were adopted at the provincial level, are now in place everywhere. So we continue to look at things, but it's by and large driven by those things. And that's why really it comes down to responsibility for all of us, and we all need to be taking part in this to make a difference.
Yeah, thanks. Okay. And just as a follow-up there, now obviously jumping from yellow to red, we're one step away from total lockdown, right? So I guess I just wanted to put it to you, I'm looking for a term other than a reality check or something like that. But I guess in terms of a message to residents here, we're awfully close to a total lockdown. I'm wondering if you can speak to that.
Yeah, Dan, that's an important point to get across. And I think the mayor's been speaking to that. Paul's been speaking to that. You know, that is what is coming next, essentially. If we don't get control over this, that we will be moving into a lockdown. I know the Premier's asked the Chief Medical Officer of Health to look further at what that might mean for Ontario, because they realize just how serious a position we're in Ontario, and how grave the stakes are. And so we want to stay away from that. You know, we've talked about the importance of being able to connect on some level. Having our kids in school is so important for their mental health. You know, our economy being able to function, people being able to go to their jobs is important for every aspect of their health. And so we need to have these changes so all of those things can continue to go on at least the level that we can under red, and hopefully improve quickly into those other zones.
Thanks.
Thanks, Dr. Richardson. We have one reporter left. I will just let everybody know we will go through questions again. So if the reporters would like to think of another question, I will come to you shortly. Before that, Katrina Clark from Hamilton Spectator is next. So Katrina, you can go ahead.
Thanks for taking my questions. So I know this is a tough one to answer, but how are people meant to reconcile the fact that restaurants are open, you can go on a patio, you can even go indoors, but you're not meant to go out except for essential reasons? What is your advice on that?
You know, I think what we've been talking about throughout this is that people need to make their own decisions about what they're going to do. And so, you know, absolutely the best advice is stay home, eat at home, have a virtual visit with your friends, have a virtual visit with your family who don't live in the home, and do things that way. There is some allowance for people to go out and do some things in very restricted ways, and doing those things in those environments where they are following the rules. It's supposed to be some outlet for that so that it can be done safely. But absolutely, it is better to take out and share it virtually and do all those other things as we go forward.
Thank you. And I just want to clarify. So gyms, is it correct that there are only 10 people allowed to be in like a full gym, like something like a Good Life? And also, what does this mean for events like weddings and like religious services, those sorts of things?
Yeah, so it's a bit challenging at the moment, Katrina, because the framework's been taken down just while they're modifying it. So I don't have the details, I'll have to say, in front of me as to exactly what to expect. But, you know, if you're reading off a copy that you've gotten off beforehand, absolutely there's these restrictions for gyms have been sharpened somewhat in terms of the number of people who are allowed in the facility. And there have been changes in terms of banquet facilities and those sorts of things. So there's no changes for religious ceremonies as I understand it at this point, but for receptions and that sort of thing, there are changes. And so we know, you know, these are critical events in people's lives. And, you know, it is not, we have great empathy for people who are going through this. And I certainly have friends and family members who have been in those places. We have Diwali this weekend, and people are wanting to celebrate together, and you know, it's challenging, but we need to do this during this period of time to get control so that we can wait until we hopefully have an immunity strategy coming up in the new year. And that's going to take us some time as well, though that's not going to be the panacea right off the bat. So it's a difficult time, but these are the changes we need to make, and hopefully we'll get this back under control and have a little bit of opening up again.
Thanks, Dr. Richardson. So as I said, we will run through again, one question each, please. So we'll start with Taz Boga from CHCH. Go ahead, Taz.
I'm actually fine. Thank you so much, though. I appreciate everyone's time.
Okay, I'll go next to Lisa.
So hi, actually all my questions were already answered, so thank you very much.
Wonderful. We'll go on to Dan.
Hey there. I know that this is not a fun thing to talk about, but I will be the guy just to ask about Christmas, because we're looking at 28 days, right? That will get us into December.